Hi, my name is John, and me and some of my medical school classmates have created a brief video demonstrating some exercises to improve cardiovascular health, balance, flexibility, and muscle strengthening.
Aerobic exercise is the sustained use of large muscle groups to strengthen the heart and lungs. This can be activities such as walking, jogging, swimming, or biking. The American Heart Association recommends a minimum of 150 minutes per week of moderate intensity aerobic exercise, or 60 minutes a week of vigorous intensity aerobic exercise. As a rule of thumb, both of these should elevate your heart rate and breathing rate. But if you can carry out a conversation easily while doing it, it's probably moderate exercise. The minutes you spend doing these forms of exercise can be split up over the day or the week.
Well, cycling is a great low-intensity exercise. You don't even need any special equipment to get a good workout in, except maybe some comfortable shoes and weather-appropriate clothing. Walking around the neighborhood is a great way to improve your cardiovascular health. And you can bring your friends or family. Just make sure you carry a mask in case you encounter a crowd.
Balance training is very important for improving stability, preventing falls, and reducing injury. Make sure you have something to grab onto nearby just in case you feel unstable, like a chair or a countertop. And what you'll do is you'll stand on one foot for 10 seconds at a time and then alternate. And you'll want to do this 10 to 15 times per foot.
In maintaining balance, developing core strength is critical. Today, I'll be going over a couple of core strengthening exercises that you can do from the comfort of your very own chair. So the first is called the Superman. So take one hand behind your head and reach down to the ground. Do the same for the other side, holding for 3 seconds. The second exercise is called the cross chair squeeze. So take one knee and the opposite elbow and reach towards each other. And do that on the other side. Hold for a few seconds. And that's it.
Flexibility is key to overall good health. It is required in many daily activities like reaching for a glass in your cupboard or bending over to tie your shoe. It is important that older adults stretch for 10 minutes 2 to 3 times a week in order to maintain flexibility. Keeping up with flexibility is important for those, especially with arthritis, if you have it in your affected joints. Here are some stretches and movements to help maintain flexibility.
For this first exercise, you need a sturdy armless chair, and you're going to put your feet shoulder length apart. You're going to bend from your hips and move down and slide your hands down as far as you can and stop when it starts to hurt. Hold this for 10 to 30 seconds and repeat 3 to 5 times. For this next exercise, you're going to need a regular sized hand towel. I'm going to take the hand towel in my right hand and I'm going to raise my hand over my head and put the towel behind me. With my other hand, I will grab the bottom of the towel. I will hold this for 30 seconds and repeat 3 to 5 times.
Resistance training is a surefire way to increase your muscle strength. In addition to increased strength, benefits include improved resting metabolism, improved glucose tolerance, increased bone density, and increased joint stability. Using household items, you can also work out the biceps. Using your textbook, bring the textbook up to your chest in a controlled fashion and release it back down. Once again, I stress, form is the most important thing, not the number of reps you do. You can also use the milk jug to do a concentration curl. Lean over with your legs spread, one hand on one knee, the other hand that you'll be using to do the curl with the elbow against your leg. Once again, in a very controlled, slow form, bring the item up and release it back down. Both of these exercises isolate the biceps.
Hello everybody, I'll be showing some exercise routines that will strengthen the muscles and prevent falls and fractures. I'll be using regular outside items like a book, I have a gym bag, and I have a water bottle. And you can do this sitting or standing, and I have a chair close by in case you need to sit down. So first I'm going to show you how the book works. You take the book and you push up and down, and you do this for as long as you can, probably about a minute. And then you can take the gym bag and you want to shift it from the left to the right and engage your muscles while you're doing that, moving left and right. And for the water bottles, or you can use a flask that's filled with water, you just go down and up, down and up, and down and up. I hope that'll be helpful. Thank you.
We hope you enjoyed the video and found it helpful. Thank you for watching.